Please, give us more insight.
Well, good morning to everyone. Yes, good morning. Well, first of all, let me thank Mr. Carson, for his kind invitation to be a part of this conference, the Third World Federation Against Drug. Thank you for your leadership and for your kind invitation, and it's our pleasure to be here this morning to present to you. What we had planned to do is, we have 3 speakers this morning. I'm going to give a general organizational overview of Community Anti-Drug Coalition of America, CADCA. And then my colleagues will talk more specifically about our strategy, about the results, outcomes, and why this strategy is so applicable, not just in the United States, good morning, Dr. DuPont, but across the world as well. But as you heard, my name is Arthur Dean. I'm the chairman and CEO of CADCA. I've been with the organization now for over 13 years after retiring from the military back in 1998. It's our pleasure this morning to present to you. This is what we want to do. We want to give you an overview of the organization, talk about coalitions, what are they, how they work, why we believe they are effective, the evidence behind them, the role that community coalitions can play in drug prevention, and we embrace the whole continuum. The continuum, we call it from education to prevention, intervening, treating, recovery, the whole continuum, and we'll talk about the role specifically that we play. There's a very special program back in the United States called the Drug-Free Communities Program. We'll give you an overview of that as well, and how the government has become a part of this strategy and the role the government plays. Then we're going to give you some examples of coalitions and what it is that they are accomplishing in their communities across the world. We'll talk about that. And then Dr. Hernandez is going to talk also about our international work that we're doing, and we hope that this will be informative to you and be something that you can use back in your country as well. So this is the organization. We call it CADCA because it's a mouthful, meaning that Community Anti-Drug Coalitions of America. It's a very long name, but the name is very explanatory, and that's really what we're all about. We're all about communities, building and empowering communities to solve their problems. That's what CADCA is all about. We came out of a presidential commission back in 1992, so we are now 20 years old. We have more than 5,000 community NGO coalitions in the United States, and a growing number of them around the world as well. And our mission is to build the capacity in the local group, and the local group then solves their problems, not us back at CADCA. These are the areas that we provide, and I'm not going to read all of them to you, but I want you to, we are concerned about making sure that our groups have all the information, strategies necessary to be successful. We do a lot of public policy advocacy work with our federal government to ensure that laws are passed and monies are appropriated. We do a lot of training and technical assistance, and talk more about that as well. Research and dissemination is so critical that the best evidence is available to them. We are concerned about our members, so we provide newsletters, Members Edge, all kinds of information. I'll talk more about that as well. We're very concerned about our young people, so we have a whole initiative built just around developing their leadership so that they can lead this field into the future, and they are current leaders today and doing great work at that. Lots of publications, and we're going to share them with you. Dr. Hernandez has some to pass out at the end of the presentation. But all of you should feel free to take, and he will share with you a handbook that talks more specifically about this. And we have, you brought the research one too, right? And we published a white paper back recently that talks about the research and the evidence that supports this strategy, and we want you to have a copy of that as well. So these are available to you here, but you also can go on our website and get information as well. So we want you to have all of that. Thau is the public policy consultant for CADCA. Been with the organization now for 20 years. And what this says is, if you look at what the President's budget has proposed to cut a particular program that we care about, or we were able to increase the amount of money going to that particular program, that since we've been in existence, the organization has saved this field nearly $3 billion. Those are cuts that would have occurred or increases in dollars that we've been able to provide. So we take this very seriously. We spend a lot of time working with our federal friends, our congressional friends, and the executive office to make sure that they are addressing the issues associated with substance abuse across the federal government, out into states and down into communities. And we take it very seriously. And the way it works is that we have a team of experts led by Sue, Ms. Thau, at CADCA. Then you have a network of our coalitions out in the communities. And you bring those two together, you end up having results. And that's the way it works. Okay? Training impact. This is just to give you a snapshot of the training that we do. What that says is that over 60,000 people have been trained. We are now training nearly 10,000 a year. And we have had almost 8,000 sessions of technical assistance. We have a full-time manager that only responds to technical assistance questions that come into the organization. So on an annual basis, we're training more than 10,000 individuals. We're receiving more than 1,000 calls for technical assistance, and we're training over 300 coalitions through our Coalition Academy to make sure that they're properly trained to carry out their work. So this is very important to us. I told you a little bit about the publications. All of you are invited to go onto our website. It's www.cadca.org. We have a weekly newsletter that comes out, and some of you are receiving that newsletter. All of you are entitled to it. It's a free publication. We are on Facebook. We have connected communities. And we do all of the social media kinds of things to stay connected to make sure that our field are feeling and involved in doing the kind of things that are necessary to be successful. I told you about our youth program. We have two large annual conferences, and I'll talk a little bit more about those, where we bring young people together to train them on all of the strategic prevention framework procedures that we train adults on, so that they can be the leaders back in their communities, and they in fact are being leaders back in their communities. At these big conferences, we have about 300 young people in training in each of them. And we also have taken this training out into communities and states to provide it as well. And we are even taking this training internationally as well. So we care dearly about training our young leaders because they are so important to the movement. In July, we have what we call our Mid-Year Training Institute. As you can see, it will be in Nashville, Tennessee this year. We will train probably 12 to 1,500 people from 4 days of training. The training is designed to provide them the skills necessary to carry out the work in their communities, and my colleague will talk more specifically about that. We do have international people that attend both of those. And our big, large annual conference, you have attended that. Yes, you have. And so have Roger's been to our training conference as well. Back in Washington, you can see it's about 2,700 to 3,000 people from around the world now, primarily from the U.S., in training for 4 days in Washington. One of the days we go over the Capitol Hill en masse to visit all of our elected representatives to impress upon them the importance of providing laws, policies, and dollars to support this work. Sue leads that effort, and we'll talk more about that. So we are really concerned about training and making sure that it happens. Evaluation and research is very critical. We have a deputy for evaluation and research, Dr. Evelyn Young. You met her in Vienna. She spends all of her time making sure that the proper research that is, one, that we have knowledge of it, that we are disseminating it and getting it out to our coalitions, and we're using best practices to make it work. So what I'd like to do now is turn it over to my colleague to talk to you in more depth about this strategy that we're talking about. What are in fact coalitions, how do they work, and why we think it's a strategy that has applicability not just in the United States but around the world. And Dr. Eduardo Hernández, who has been leading our international work for the last 5 years, is going to have those discussions with you now.
Good morning. Continuing on, we will be talking about coalitions and identifying this strategy. And for those that want, we have brought this publication with us, which outlines the research support behind the strategy that we employ. One of the things that we do that General mentioned is we really place a great effort in translating research to the practitioner level. In the United States, we have indications that only about 5% of the practitioners read the research journals. I'm sorry for those of you who are researchers in the field, but most practitioners don't read the research. So what we do is we take it and we translate it and publish it in fora in different areas that the community people can actually understand, can read, and have access to it, rather than thinking that they're going to read research journals. But we think it's very important to do that, and it's something we take seriously. So for us, what are the coalitions? Coalitions are formal arrangements for collaboration between different groups of community, in which each one of these groups retains its own identity, but they come together to work for a common goal. And the common goal for CADCA is a healthy, safe, and drug-free community. So it's important that, for example, if an organization comes to be part of a coalition, it's a Boys and Girls Club. It doesn't cease to be a Boys and Girls Club. What it does is it joins a larger body to work using evidence-based strategies. So it makes common sense, right? That because in many cases you have organizations that are operating really in a silo, in a vacuum. So oftentimes we go into communities and the school officials will be having certain prevention programs, but the police won't even have a clue what they're doing. And the health department will not know what the police and the schools are doing. So at least in this sense, we're beginning to foster communication, effective communication, and hopefully effective collaboration. And they say that imitation is the best form of flattery. And this is actually a CADCA definition that was subsequently adopted by our national government. So if you go to national government publications, they'll look at that definition, and it's something that we developed here. So again, it's the notion of creating a vehicle. This is important. A vehicle so that community sectors can come together and carry out evidence-based strategies to achieve reductions at a population level. The N, for example, the numerator for us, the denominator, all of these should be in the community. As I mentioned, this is not a prevention program because we look at scale and scope should be the community. So that if we're looking at the community where I happen to live in the state of Maryland, which is Gaithersburg, it's not a prevention program for 50 kids in a school in Gaithersburg, it's for the entire population. We want to achieve reductions in the entire community, in this case where I happen to be alive, be residing. So who are these key sectors? And this actually has been embodied, thanks to Sue working with our National Congress, has been embodied into national law. So that if you want to participate in Drug-Free Communities Coalition, which I'll talk about, or what I was going to talk about in a second, you have to have a minimum of these 12 sectors. You need to have law enforcement, right? So this means that every coalition in the United States will have law enforcement, in some sense, represented at the table. Youth. Oftentimes what we find is that prevention programs are for youth, but youth are nowhere present. Youth are nowhere sitting at the table when these programs are divided. I mean, you know, it's like this doesn't make any sense. If I have a program for youth and I don't have any youth sitting at the table, and I look around, I see a lot of young people here, but we're really talking about kids who are 18 years old or younger. They should be present. So parents, businesses, media, schools, youth serving organizations, the faith community, we think is a critical element in community coalitions. So all of these are at least the minimum that one should have. And as I often talk about when I lecture internationally, I'm a senior citizen. That means I'm an older person, right? So, and I said, well, you can put senior citizen organizations there also because they have a lot of talent, a lot of expertise, and a lot of time. You know, this is only a minimum, and you can have different representatives. But think about having a table where these folks come together and talk and collaborate. This is the strength of a coalition. This is where really you gather a lot of the synergy, a lot of the creative forces. Now, so what do these people do when they come together? You know, this is the key question. And from our theoretical perspective, we realize that no single strategy is going to succeed. No single strategy is going to reduce substance abuse on a sustained basis that we would want to see, right? So, you know, when I started in this field, and Sue and I have been in this field quite a long time, when I started in this field in the early 1990s, we were doing all of these alternative strategies and information-based, and a lot of, course, scare tactics that we used in terms of school. A lot of these didn't have any impact, didn't have any effect, and in some cases had the opposite effect. So now we're more sophisticated, we have a better evidence base to what is effective, and we realize it's not going to be any single strategy that's going to resolve this issue. So we use as our theoretical basis a socio-ecological perspective that was actually articulated quite a while ago by Bronfenner and has ecological levels of analysis. And I think in a couple of other presentations, other presenters have referred to this theoretical model. So this is what it is. The socio-ecological model posits a variety of different concentric circles in which you look at from the individual to the macro system. Oftentimes, prevention programs are focused upon individuals or on a microsystem. Microsystem would be your friends or your family. But we feel that a coalition is more effective if it's looking at the outer circles of this model, at the localities or a macro system. A macro system would be an entire nation where we function at, right? So if you posit this socio-ecological model and you're looking at the outer rings, you realize that one localized prevention program isn't going to cut it, isn't going to have the impact that you want. Because if I again have a prevention program that's an after-school program for 50 kids in a local school, explain to me how that's going to have an impact on the entire locality. Well, it isn't. It really isn't. So you have to have population-level strategies. This is what the research is indicating. Population-level strategies which are going to impact the outer circles of the socio-ecological models, particularly the localities and the macro systems, okay? So we have a planning process that is the basis of our training, of our work, whether it's in the United States or whether it's internationally, that focuses upon the 5 major elements of what this is called in the United States the Strategic Prevention Framework. And this again has been used by the federal government from the Department of Health, the Ministry of Health, you might say, that has embodied this. So, and this is actually why we're able to work internationally, because we don't have a model program. We have a strategy. Whether you're in Lincoln, Nebraska, Lima, Peru, or Milan, Italy, you should assess your community in a structured, sophisticated way. You should develop capacity. You should be planning. You need to evaluate, doesn't matter where you're at. You need to select evidence-based strategies to implement here. So this is the basis of how we train communities, not prevention professionals. We train communities to work on all of these elements within this circle. And this is our coalition planning process. We don't feel it does any good to have 1 or 2 key professionals in a community do all of the work. We have to empower residents, parents, youth, and professionals, and others to be able to sustain this work. We know this isn't going to be resolved in 6 weeks or 6 months. It's going to take a while. So unless we have that capacity development within a community, we don't think this is going to be sustained on a long-term basis. Again, for us, it is very critical that we understand that what we're talking about is not a prevention program. We have nothing against prevention programs. As a matter of fact, we have an incredible body of work in the United States published by NIDA, the National Institute of Drug Abuse, about prevention programs. They really do. We have some very effective prevention programs in the United States. Actually, there's a list of them on our website published by the government. However, we find that in most cases, prevention programs don't have the scale or scope sufficient enough to bring about population level changes, which is what our goal is. Okay? We have curricular programs, we have life skills programs, we have many of these programs that are very effective. However, note that a coalition in terms of its scale, we measure success by community level indicators. Did sales of alcohol to minors go down in the entire community? Did use of marijuana go down in the entire community? Right? Were there less hospital admissions for overdoses in the entire community? Where the program measures individual changes by those. I had 50 people who went through my parenting program, and 25 completed all 5 weeks. Okay? We also address multiple causes. Because since we're looking at a complex complex problem, we're realizing if you're looking at risk and protective factor theory that exists in a variety of different domains, there isn't just one cause for substance abuse, right? This ranges from individual to community risk factors. So rather than focus upon a single strategy, we need to focus upon the risk factors that have been identified, the community problems that we tend to call them. And finally, we believe that the actors, the key ingredients of a coalition is the community, is the community sectors, is the community residents. Those people who are not going anyplace, who live there, right? Not the professionals, or not the program staff, are going to be the ones who implement the programs, right? If I want to implement environmental strategies, this is going to take really a concentrated effort, as Sue will talk about, right? We really need to mobilize people to get about things. Because, for example, in the cases of alcohol industry, or the drinks industry as you call that here, you know, these are very well-entrenched interests. You know, one person, if I go up and say, well, I think we should tax alcohol, yeah, good luck, Eduardo, thank you very much, goodbye, right? But if we have a concentrated effort, we think that has a greater opportunity for success. Okay? To work at all levels of the social ecological models, we train communities to use 7 behavioral change strategies. And this didn't come from us as much as it came from the University of Kansas Work Group for Community Health and Development. The group is headed by Dr. Stephen Fawcett and Dr. Vince Francisco and Dr. Jerry Schultz. It's a WHO collaborative center. And they actually helped us in the onset to develop a curricula based upon these 7 strategies. So that we know that if you want to provide information, and that's a critical thing, as some of the speakers mentioned yesterday, yes, we need to educate parents, we need to educate kids, that's not going to be enough, right? I remember going into doing some work in a South American community in a country, and I went into a school and I said, so what's the problem? Well, we have a lot of cocaine use in the school. And I said, so what are you doing? And I said, well, we're giving lectures to the kids and we're training the teachers. And I said, so where are these kids getting the cocaine? He said, well, there's guys 50 meters outside the front at the end of the school day that are selling small dosages of cocaine and basic paste, pasta básica, to the kids. I said, well, wait a minute. You're in here giving lectures to the kids, and 50 meters away, there's somebody out there selling these same kids drugs. Well, you're not changing, you're not doing anything. You're just providing information. You actually, I think, wasting your time, and they were upset with me, but then later on they realized what I was saying. You need to provide information. Yes, that's critical. You need to build skills. Refusal skills, communication skills. You need to provide support. But we think that the essence of coalition work resides in strategies 4 through 7. And actually, we've changed that a little bit from reducing and enhancing barriers. We need to reduce access to drugs. We need to enhance barriers to selling to minors. We need to look at community festivals, wherever they are, to reduce the access to drugs. We need to reduce barriers to treatment, right? We need to reduce barriers to people coming into that need recovery services. We need to change consequences, right? We need to change consequences. I'm working in Peru, where there is an incredible problem of sales to minors, sales of alcohol to minors, right? And the community is going around to some of these bodegas, some of these stores, and saying, we're not going to take this anymore, right? And if you keep doing this, we're going to denounce you. We're going to do this. We need to make sure that there's consequences for some of the activities that are going on there. And incentivize, right? And incentivize for those people that are obeying the law. Those people that refuse to sell tobacco and alcohol to minors. We incentivize them. We point them out. Look, that guy is a good actor. He's a good player. We talk about the physical design of the environment. In another South American country, and when we do assessment, we don't just ask who's using. We ask, where is this going on? Where is the use occurring? And in one country, they told me, well, the place is in the park. And we can't use the park anymore. We can't send our kids to the park because after 7 o'clock, it is full of drug users. So what we're doing in that community is helping the community retake the park. I told them, you've lost your human right. You can't even go around, you can't even walk around here because these guys have taken your human right to walk around. You can't send your kids to the park. So we're working with the community to go in and take back that physical design. In some cases, it's signage. In some cases, it's looking at illumination, right? In some cases, it's in the United States, it's destroying crack houses, right? You need to look at the problem environment. Look, drug use doesn't occur in cyberspace. It occurs someplace. And in our community assessment, we actually help them do geo-mapping. Where is the problem occurring in your community? Is it a liquor store? I remember once I was doing some work in Oakland, California. And the police guy told me, he says, look, I can tell you exactly where the problem occurs. He said, I can tell you the name of the bar. In the bar in Oakland, California, where there's drug use in the back, they go to the men's bathroom. I can tell you which bar has the prostitution. I can tell you which bar has gun sales. You know, in other words, where in this community are kids getting access? Where are kids getting, and trust me, when I was working in Brazil, I had a 15-year-old kid stand up. And I said, if I gave you this 10 pound bill, could you bring, I said 30 minutes, I'll bring you back to marijuana. So tell me, where did you go? And he told me he could identify even where you could buy guns at. It shocked people. A 15-year-old kid could tell you where you buy guns at. So we have to identify these problem occasions. We need to look at this. And we also need to change policies and rules. We really need to, and of course I know I'm speaking to the choir here because so many of you are involved in policies. So many of you are involved in changing the policies in a variety of ways, right? And we're finding, for example, that the kids in some of the states in the United States are very confused now because they hear of this medical marijuana, that, you know, all of these lies, you know, I mean, as we were talking about, that was a strategy of these guys to call this medicine, right? It was really quite an effective strategy. They called this medicine, but we need to change the rules. We need to change the policies. So an effective coalition uses all 7 of these, not just one. So an effective coalition will have media. An effective coalition will use social media. We'll have publications. We'll educate parents. We'll provide support, but they'll do also strategies 4 through 7, which we think is the essence of the work that we do. Okay, and again, the environmental strategies are used to change the context. Right? The context. And so this requires us to train people in environmental strategies assessment look at mapping. And actually, General Dean mentioned our training in July in Nashville. And we are bringing some national experts on geographic information systems, because this is all done now on computers, to work with communities. And not only in the United States, I'm bringing like 20 people from different parts of the world, from the Philippines and Central Asia and South America. They're going to come together and we're going to train them how to do sophisticated GIS mapping, because it's critical. It's not just enough to tell you, okay, I've got 5% of my kids using drugs. No. We need to take a look at where are the problem environments within a community and locate this. Okay? Now, Susan, so you know, I've talked a lot about theory, and let's take a look at how some of these communities use this theory in a very successful fashion. Sue?
Yes, well, good morning. We're like thrilled to be here, and so people will say, okay, we understand the theory, but can you explain how this works on the ground? How do coalitions actually do what Eduardo talked about with the whole strategic prevention framework planning process and those 7 change strategies? So I'm going to start by giving you a case study example of a community in Florida that had a horrible meth problem. So as Eduardo said in the strategic prevention framework, the first thing people have to do is actually assess the problems in their community by looking comprehensively at the data that's available. So in this case, this Florida coalition looked at their middle and high school lifetime usage rates for methamphetamine. So the community is in white, and the statewide averages for the usage rates are actually next to them. So middle school students in this community had twice the lifetime meth use of the state, which in all honesty was much higher than national averages. Meth was one of those issues that it was not pervasive across the entire United States, but where it was a problem in communities, it was a terrible problem in communities. And frankly, national data sets were not picking up meth as a gigantic problem because it was so regionally and locally, it was regional and locally, that's where it was. So, concentrated. Thank you so much. So these guys looked at a lot of data, but their school survey data was frightening. They had 11.1% of high school students reporting that they had actually used meth, compared to 3% is the statewide average for lifetime use of meth, compared to about 1.2% at the same time for national use of meth. So meth, they knew, was a horrible problem in their community, but for their youth. Now, these guys also looked at other data. They looked at arrest data, they looked at hospital admissions data, emergency room data, police arrest data. These guys really knew that they had a problem, but this particular data of what was happening with their youth was horrifying. So what they did was they got all the 12 sectors that Eduardo talked about together to talk about what was causing this problem in their community. Why was it so much worse here in this part of Florida than it was anywhere else? And part of it was that people were not getting the message that meth was dangerous. They didn't really understand the costs and consequences of it. Law enforcement knew that it was a problem, but they really needed community support to figure out where the meth houses were. They needed people to actually work with them. They needed their emergency room and other people who came into contact with people to be trained to recognize the signs and symptoms. They needed the community mobilized so that when they did enforcement efforts, people were behind the police. And it's, you know, law enforcement is at the table. This strategy of coalitions is one of the few that involves both demand reduction and supply reduction, meaning the police are involved in reducing supply, and that has to happen at the same time that you're working to educate parents and students you need to do it all together. So I'm going to now run quickly through some of the strategies that these people decided to implement to deal with the exact problem in their community. So the first one was strategy one that Eduardo talked about. They did a gigantic community meth awareness campaign that reached everybody. They used radio, television. They did it through the schools. They took out ads in newspapers. They did everything that they could to raise awareness throughout the whole community. Again, this is with scale and scope, to try to reach everybody from youth to parents to grandparents to business people about what was going on in the community and the fact that meth is really a dangerous drug and that this was a horrible problem. They initiated direct mailings to key business and community leaders about this so that they would get involved, so that it wasn't just the grassroots people understanding this was a problem, but the community leaders had a role in helping to make sure that this was dealt with. They provided parent education on meth, and this is what's interesting about how coalitions do what they do. So parent education, it's great if you do it in the schools, but the community coalitions have access to the business community, they have access to the faith community. So when they do parent education, they do it throughout all of the sectors so that they can reach parents where they are. Everybody doesn't have school-age children, and in America now, a lot of both parents work, and there are a lot of single-parent families, and they don't actually get to necessarily go to the school meetings. So they do parent education in the workplace so that they can actually get them where they're working. They'll get them through their religious institutions so that the pastors, the imams, the rabbis, the clergy, they're all involved. So they do this with scale and scope so that they can reach as many parents as possible with the education. They did school-based education for youth on meth, but they did it K-12. They did it for everybody in the school system. They didn't just do it for one group of children. So again, scale and scope is really important. And they did a gigantic local media campaign about meth. So again, radio, television, newspapers, signage, billboards. They really took this throughout the entire community. They did a gigantic meth awareness neighborhood resource guide so that all of the households understood what a meth house looked like, smelled like. The fact that where you have meth houses, it's a community danger to everybody. These things can blow up. They use poisons to make meth. This is really a community environmental problem, and they raised awareness about that. Now, interestingly, we don't have real estate agents as one of the 12 sectors, but for meth, it became really important to train real estate agents, both people who sold and rented property, because they were in properties that could have been meth houses. They were trained to identify what that looked like so that they could tip off police and the environmental people to do something about it. They also did major trainings for school, healthcare, and police personnel on how to identify someone who might be under the influence of meth so that they could get them into treatment, get them an intervention, get them the help that they needed, and so that was done throughout multiple sectors as well. Now, they also implemented tip lines so that drugstores, this was before they had pseudoephedrine, which is the major component of meth, behind the counters. So they had actual tip lines of people who worked in pharmacies and drugstores. Those guys, if someone came in and bought 27 packages of meth at a time, called the local sheriff to say, this looks like something's wrong here. This is, these guys are probably going to be cooking meth. They bought much too much of this. So that the guys in the pharmacies were trained to identify what was happening and to call law enforcement when there was a problem. They established and supported neighborhood watch groups so that community people could see what was happening. They were trained to notice, again, if somebody was cooking meth, if somebody looked like they were under the influence. And so they could call police if they saw that there was a problem in the community. Law enforcement then worked to close meth labs. So law enforcement was intimately involved, but they had community support, which is critical. And that's one of the very important things about community coalitions. When the community both the leaders and the people who live there support law enforcement actions, it's much easier for law enforcement to do their job without getting screamed at by people or people saying this is sort of unfair and we're being treated badly. In these communities, people actually understand that law enforcement is critical. Consequences are a critical part of the coalition strategy, right? There has to be consequences for selling drugs, because otherwise, why would somebody stop doing it, right? We do need law enforcement. They implemented drug-endangered children programs because when you went into a meth house, unfortunately, there were children there and they were being exposed to horrible conditions, horribly unsafe chemicals, and so they had social workers who would actually go along with the police if there were going to be children in the house so that they could actually get the children into social services that were needed and try to get the parents into treatment. And they worked very hard to restrict access to the products that contain pseudoephedrine. And in fact, we did in our country get laws passed so that pseudoephedrine is now not only behind the counter and you have to sign for it, but you can't buy more than a certain amount of it in a certain amount of time to really try to reduce the precursor chemical availability. So as a result of all of these strategies being done together at the same time throughout all of the community sectors in this community, in just a 4-year period between 2002 and 2004, their middle school lifetime meth use was reduced by more than half to lower than the state average, which is really amazing. And their high school use was cut by 2/3. So these guys had baseline data, they implemented all of those strategies that I talked about based on their community conditions, and they actually, in 4 years, were able to reduce the problem substantially, which we think is a really great outcome. Okay, so communities, coalitions actually do produce community change because, and this is reiterating a lot of what Eduardo said, they impacted an entire community. What they did was with enough skill and scope that they got to everybody. They engaged all of the community sectors, so police, the business community, the pharmacists, the real estate people, parents, schools, the faith community. Everybody was involved in the effort to push back against meth use in their community. They addressed the conditions and the settings in their community. They identified exactly who was using, where they were using, that they had a gigantic problem with youth and adolescents, so that they knew that they needed to do strategies to get to them and their parents that would reduce use. And they promoted comprehensive strategies. They did enough with enough power and effect across the whole community and across demand and supply reduction to actually get behavior change, right? These guys actually did reduce use. And well, the end is they did reduce use in the community. And this is just one example. We have hundreds of them where this model works. It works for meth, it works for tobacco, alcohol, prescription drugs. It works. Okay. So the drug-free communities is something that both Eduardo and General mentioned. It's the national program in the United States that actually funds community coalitions to reduce youth substance use. So these community coalitions can apply for up to $125,000 a year from the federal government for up to 5 years to be able to not only build these coalitions, but operationalize them so that they do everything Eduardo said, from assessment through evaluation. The program actually requires that reduction of substance use among youth is the principal mission of the coalition. These coalitions have to target multiple drugs. They actually have to have all of the 12 sectors that Eduardo talked about actively involved at the table. It's not enough to just show up. They actually have to be implementing the strategies that are part of the community action plan. And this program in our country requires a dollar-for-dollar match. So for every dollar you get of federal money, the community has to come up with a dollar for that the community puts in. And this was done in part so that they would be sustainable over time after the federal grant wasn't there anymore. So the program has extremely broad support, both in the administration and in Congress. since the program was started in 1998, it's had the support of 3 presidential administrations and very broad bicameral bipartisan support, meaning both the Republicans and the Democrats support it strongly, as does the House and the Senate. And one of the reasons the program has so much support is that this is a data-driven program, meaning one of the requirements of the program is that people collect baseline data, both from school surveys, but from the other types of information. I said, you know, emergency room information, arrest information. These guys really come in having to understand the community conditions and what's going on. They have to have the infrastructure in place to address not only, you know, pervasive problems like marijuana, meth, inhalants, cocaine, but emerging drug trends as well. Our people are on the front lines of K2 spice and bath salts, the synthetic drugs. Our people were among the first to understand that those were a major problem that was happening with youth. And also prescription drug use. So our guys really look at the plethora of drug and alcohol and tobacco issues in their communities. And in fact, we have great outcomes that I'm going to show you from a national evaluation. Drug-free communities grantees have reduced drug use levels in their communities to levels lower than national averages. So I showed you the case example, so specific coalitions are doing it, but we have a national study that actually shows the same outcomes. So this is a program where a very small investment of federal dollars, $125,000 a year, actually yields results in lower drug use rates. So, and I'm going to skip this one. At this point, about 2,000 community anti-drug coalitions have been funded since the beginning of the program in 1998. And at this point, we have about 726 communities that are being funded, and the program gets about $92 million a year from Congress. CADCA is the primary technical assistance and training provider for the program, and we have fabulous trainers, fabulous curriculum. Every single grantee goes through something called an academy where they get 3 weeks of intensive in-house residential training and then distance learning throughout a year. So we're basically training people to be community epidemiologists, to be, you know, strategic planners. These guys, for a tiny bit of money, are doing a lot. So the program has proven effective in reducing drug use. A recent evaluation that was done by the Office of National Drug Control Policy showed that over the life of the Drug-Free Communities program, youth living in funded communities have reductions in alcohol, tobacco, and marijuana use among their youth in the communities that are funded. And so this is the percentage declines in use from the first report of data of a funded community to the most recent report. And as you can see, in middle school, alcohol, tobacco, and marijuana use have all gone down substantially. And in high schools, alcohol, and tobacco, and marijuana use have also seen marked reductions. So drug-free communities, coalitions, have lower substance rates than non-funded coalitions. So the prevalence of 30-day use of alcohol, tobacco, and marijuana was lower for high school students in drug-free communities than a national sample of students in communities that were not drug-free communities. And interestingly, we don't cherry-pick these communities. They have to have show that they have a really bad problem to be able to be chosen to be funded. So the fact that we are seeing, like in Florida, the case, people who have 5 times the national average applying for a grant and within 4 years bringing their rates down to about national or state averages is really a fabulous outcome. So I want to give you a couple of more case studies and examples of what drug-free communities have been able to accomplish and the types of strategies that they've used to do that. So this is Sylvania Community Action Team in Ohio. And so they started with marijuana use among 10th graders at 20.1% in 2002. And you can see the little yellow, and let's see if I can do the little pointer here, right there. This is the national average at the time in 2002. So they started way higher than national averages for 10th grade marijuana use, right? The national rate was 17.8%. They started at 20.1%. And over the 8-year period, they were able to reduce 10th grade marijuana use to 10.6%, and yet the national average only went down a tiny bit to 16.7%. So these guys are doing something right because they're starting higher than national averages and ending lower than national averages in just 8 years. So what strategies did they use to implement to get these reductions? They partnered with local newspapers to raise awareness about the risks and harms associated with marijuana use. So again, scale and scope, getting the message out to everybody in the community. They increased law enforcement capacity so that in fact there were consequences for selling, for using in this community. They provided parent education workshops, again with enough scale and scope to reach all the parents and caregivers in the community, not just 50 people in one venue, but across the whole community. They provided youth leadership training so that they picked youth leaders who then changed the norms in the community by, you know, being drug-free and making it the cool thing to do in that community. And enough of them were trained with strategies to get enough other youth involved that it moved the needle. And they worked with local schools to implement zero-tolerance policies related to drugs. Again, consequences. If you were caught using, you were going to be suspended, and you knew that you were going to be suspended, and there was no question about the fact that there were going to be consequences. Okay, one other example. This is the North Coastal Prevention Coalition in California. So, they started in 1999 with pretty high marijuana rates. Those are the 3 counties that make up, or the 3 communities that make up their coalition. And from 1999 to 2007, they had really great reductions in marijuana use. Now, of course, California is where medical marijuana started. So I'm going to show you what these guys did that's really very interesting, that talks to the environmental strategies that Eduardo was talking about. They were able to see marijuana use reduced at a time when in other places in the state, because of access and availability, because of the dispensaries and all of the, you know, hype about medical marijuana, they really pushed back. So they increased public awareness of the harm of marijuana by youth. They also, on 420, Michelle talked yesterday about what the big celebration. They have an anti-marijuana celebration for youth that has totally drug-free activities that's covered by the media that basically serves all of the youth in the community so that they have something really fun to do on that day that has nothing to do with marijuana use, that gets a tremendous amount of news coverage. They also increased youth leadership in marijuana prevention efforts because youth tend to listen to other youth. And it's not just talking at youth, it's getting kids involved in pro-social, anti-drug activities. They countered the pro-marijuana marketing with anti-marijuana marketing. And this is the really interesting thing. They reduced the sale of pro-drug merchandise because they passed a local ordinance that made it illegal to sell drug paraphernalia in their town. So it's sort of hard to smoke marijuana or use drugs if you can't buy rolling paper, if you can't buy a bong, if you can't buy a pipe. All of that became illegal to sell in their community. And the police were actively involved in enforcing that ordinance so that anyone caught selling that was fined, and if they were fined a couple of times, they could end up being arrested. So they got around this whole pro-marijuana, it's really available thing by cutting off all of the supplies of how you would actually use the drug. And it worked. It worked in their community. So they did more than just raise awareness. They also increased police, increased consequences, and changed community environments and norms by passing an ordinance that was enforced, and it was enforced a lot. So anyway, so I'm getting now a little bit into the evaluation of CADCA's model to actually do training and technical assistance. So what Eduardo talked about, the strategic prevention framework, the assessment through the evaluation and the 7 strategies, we actually have data and an evaluation from Michigan State University that shows not only does our model work, but the training that we do on the model works. And it works to basically help build the capacity of community coalitions to achieve outcomes faster and with more intensity than if these coalitions were not trained by CADCA. And so, in fact, the findings of the Michigan State study were that the training and technical assistance that CADCA provides triggers the process of change that actually improves a coalition's potential to achieve the population level outcomes that we showed you in the case studies and also in the national evaluation of the program that was done by ICF International. And now I'm going to turn it back to Eduardo, who's going to talk to you about our international programs.
And I was just thinking as I was looking at Sven Olaf here. Sven Olaf and I actually both attended the Global Alcohol Policy Conference in Bangkok in February, I believe. And at that conference I spoke on how these coalitions are impacting problem alcohol environments and problem alcohol problems. And this morning I was looking at the news on my Droid, and there was a news on Join Together yesterday about how the 7-Eleven Corporation is now going to modify its practices to make it more difficult for kids to get access to tobacco and alcohol. Now, I've seen 7-Elevens all over the world, literally all over, including in Bangkok. There's a lot of 7-Eleven stores. So it's important that businesses, for example, when Marriott hotels went smoke-free before the laws were even there, it's important that businesses get involved in these coalitions because we have pressure upon them to actually become involved in coalitions. And nationally, General Dean has brought a lot of the national corporations in the United States together. So as we move in different countries, obviously a community coalition in Brazil is going to look very different than a community coalition in the United States. And that's fine, because we encourage people to adapt their strategy to their local communities. Communities across the world realize that what we have is an international problem, a national problem, but also a local problem. The manifestations are in their local community, and they actually feel more empowered to work in their local community rather than trying to impact a national or international problems as the World Federation is doing. Okay, so as we go into communities, we look at how they can become change agents within their social political context. We don't export a social political context from the United States. We help them understand the technology that we have developed in the United States, but they're clearly on their own. And one of the most beautiful presentations was done by somebody from Peru who said, we took the CADCA training, we maintained fidelity to the basic concepts, and then we adapted it to our reality. Now, gentlemen, I think you recall that presentation. It was really quite interesting. And it's also, if you can see these two slides, this one is from Peru, where actually all of the coalition folks wear blue vests. And they originally started doing this for security reasons, because they were walking their communities. They wanted people to identify them as members of a coalition. It wasn't just some guy walking around asking questions. But now they have done it also to identify themselves. And in the back of the vest it says Community Coalition. The only thing missing is you. And in this one, this is in Brazil. So in a sense, we've gone in some communities where there actually was a tradition of community mobilization, community activism before we even showed up on the scene. So we work to assist NGOs like ourselves and governments to look at the development of community coalitions, effective community coalitions, to reduce the rate. Currently, we're in or about to go into 16 countries in the United States, and this photo, as you can see, actually is in Africa. Our programs are started in 2004. We are partnered with the United States Department of State, the U.S. National Guard. The U.S. National Guard actually helps provide us with translation of materials. They have linguistic experts that do these translations for us. And an organization called the Colombo Plan, I think some of you are familiar with, is headquartered in Sri Lanka. We're working with them, particularly in the Philippines, where this photo was taken recently, where we're going to begin working in 2 areas of Manila, and that is the Dangerous Drug Board, the equivalent of our national drug board there in Manila. And again, all of our trainings are geared to help communities achieve population-level reduction in substance abuse. And what we do is we provide training and technical assistance to selected communities. And currently we're involved, we started out mainly in Latin America, and as you can see, some of these are problem countries. I mean, it's not easy to work in. I go over there, and you know, when you have a government like the current government, which is pro-coca leaf, pro-growing coca leaf, and you know, all of these other kinds of things, this is not easy. Currently, this week we have a team in Kenya, in Mombasa, on the coast in Kenya. Believe it or not, I'm going back to the United States on Thursday, then I'm going to Cape Verde in Africa on Friday. Yeah, I know. She looks at me like, this guy's too old for this guy. We shouldn't be doing this. I know, I should be getting senior citizens. And we've talked to our dear friends here, Diouf, about going to visit Senegal shortly. Kazakhstan, Kyrgyzstan, Tajikistan are Central Asia. These are former Soviet Union countries. They're being heavily impacted by the opium that's coming out of Afghanistan. It was a shock to me to find out that there's a Soros Foundation office in Kyrgyzstan. Yeah, I was unaware of that, but they literally have a Soros Foundation office in Kyrgyzstan. And when I was in Tajikistan in January, one of the people from the national government, the narcology center, said, you know, this is the first time we've heard about prevention, because all we've been hearing about is needle exchange. Little exchange by some of the European NGOs that are over there. They're like, you know, all we've been hearing is needle exchange. You're the first guy that said, you know, that harm reduction stuff is very, because I said it was very pessimistic. You know, that you can't do anything about it. Yeah, you can't. Here's, as we showed, here's some examples of communities that are doing something about it. And as I said, we're also doing this for Philippines this year. We currently have resources in English, Spanish, Portuguese, and Russian, and we're starting in French, and we have materials in English, Spanish, and Portuguese on our website, and by July we'll also have Russian and French. So we think that's critical, because we'll have 3 of the critical languages from the United Nations that you can access our materials in there. Oh, that's a picture of a coalition in Brazil, in Sao Paulo state, and that's very interesting. This fellow on the left side is a deputy, a state deputy, right? And he's also a priest. And there, that's not a problem. You know, you can be a priest and be an elected official. And the fellow next to me actually is a priest, and he's vice president of the local coalition there. And you know, so he talks about substance abuse on Sundays after he finishes, when he's talking to the people in his parish. You know, it's really quite very much very interesting. These people are doing such good. We brought them to the United States, as a matter of fact. This time, generally, I think we have about 20 international visitors we're bringing to the United States. And we also have some people from our U.S. embassies that they find out what we're doing, that they on their own resources come, because they want to find out what is it that we're doing over here. So this lady is a Brazilian, and she's going to be working with me in Portuguese-speaking Africa. We're taking her to show how the Brazilians can do it, so then you can do it in Africa. And as Fenola pointed out, we are an NGO in working with the Vienna Committee and working with other groups there at the United Nations, which is some of you have been there. It's quite an interesting environment, to say the least, right? Oh, this is our Russian language materials. So if you can read that, you're better than I am. Someone can read the Russian language materials. And I know we've gone through a lot. We've talked about who we are. We've talked about the coalition strategy. We've talked about some of the evidence base, and everyone, please, we have materials here. You can if you want to have more information about this, our colleague Dr. Yang, who was in Vienna, is our head of our research and evaluation she was going to be here, but she's getting married on Saturday. And I said, where's your commitment? But she decided not to come after all. But she certainly is available to answer any questions. And I talked very briefly about our international work. And we showed, so how is this theory kind of, in a glance, how is it? And then Sue talked about, well, here we have this national program, here are some results. So, if we have time, General Dean, I think there's a microphone here. If you want to ask questions, please feel free to do so to any of us.
I think we're scheduled to go to 10:30.
Yes, yes.
So we intentionally wanted to leave some time for questions and dialogue, so we have about 20 minutes. So any questions, comments concerning the strategy? Yes.
Thank you for your very eloquent presentation. We all benefit from what you are doing. We are all learning. The question is not completely related to your presentation, but I take this question in behalf of our friend here from Britain. He's very young. He's somebody who asked me a question in relation to United States. And I don't want him to feel alone here. I cannot answer his question in relation to United States, of course, because I'm Romanian. And, but he believes that if we legalize drugs, we'll be all happy and we'll eliminate...
It's not true. That's not what I said.
Okay, well, anyway.
If you're going to characterize what I think, then I'll speak for myself.
Okay, perfect. Anyway, what I would like to clarify a little bit, and maybe you as US citizens, as being so informed, clarify, is that he tried to convince me that a lot of prisons, millions of people are going to prison in the United States for drug use.
No, I said lots of people in the United States are in prison for drug possession.
Possession, yes, perfect, okay. Right. I looked at the statistic your government provide us with, and I seen there that almost nobody is going just for possession. And if you have another crime on your pocket, then you go to prison. Thank you very much.
Okay. Let me quickly answer your question, but what I would really like to focus on is helping people better understand our coalition strategy. But quickly, the U.S. government current policy is against legalization. That's the stated policy by the president. Number two, we have done lots of research, and there's lots of debate in the U.S. on people incarcerated. But what our research has really shown us is that those that are incarcerated are not for use of drugs, but for criminal activity associated with their drug habit. So is drugs driving the problem? Yes, but are they arrested simply because they were using marijuana? The answer is no. They were arrested because of either they were conducting criminal activities to get the dollars for purchase of the drugs, or criminal activity as a result of being under the influence of drugs. But that's really for another day, another discussion. What I'd like to focus on now is to help you better understand this strategy that we believe that can help communities all across the world come together and solve these very intractive, difficult problems in their communities. And I was struck by your presentation yesterday, and I hope that you see that this strategy incorporates many of the things that you did in your country of India and brings law enforcement in as a major player in helping us solve these problems.
I have a suggestion for that.
Yes.
Just
Microphone, please. Did I answer your question?
It's not my question, it's the gentleman's question, because he told me that he met millions of people in United
Not say millions.
I think
Let's move on.
he's very capable of speaking for himself.
Since what you're saying exactly was tried 25 years ago through my tenure, and it was just common sense that you've got to involve all stakeholders, otherwise how you could have prevention. It's sheer common sense. But I'm sure that you've proven by evidence common sense works. Now, what I'm thinking is, I think it's almost time for a community radio on drug-free world. Almost time for a community-free radio. 24/7 or 12 hours of the day, doesn't matter. But it's time, just as we listen to the BBC, and because it's a global problem, and all of us around the world need to connect with each other beyond conferences. And let this world radio, drug-free world, called Coalition Drug-Free, whatever, come up during the day where we talk about our programs across continents. That means we keep informing communities. And then we announce our programs, this program at such and such time of GMT, listen to this program called the CADCA, or look about the World Forum Against Drug Abuse. I think it's almost time now, I believe, using the power of media. Because drug flow will continue to come. Because you are up against billionaires of drug traffickers. That means we are in it for lifetime. Because it's a fight between who wins, drug traffickers or drug preventers as we. Drug traffickers will go on because nature will keep producing poppy, nature will keep producing cocaine, it will keep producing the rubber plant, so we will continue to have these drugs. So one hand we have the drug inflow, on the other hand we work on prevention. So let prevention win. Now for prevention to win, we cannot wait to travel all the way, but also supplement with a coalition radio. So I was thinking, here is what does it mean? What kind of financial investment it means? Who runs it? Who all participate in it? I think I'm just trying to sow a seed of an idea called Radio Against Drug Abuse. Thank you. Have internet radios. You literally can have internet.
Okay, can I say something?
Where's the question? Go ahead, please.
Yes.
I'll respond.
I've seen the bulk of your work at CADCA is based on baseline data. And from where we come from, data is a huge problem.
Yes.
Even the issues of our population, we're not sure. I'm from Nigeria.
Right.
We're not really sure of some of these things. And I don't know what advice you, CADCA, will have for countries that are deficient in data. Because we experience the problem, we feel the problem. Just early this month, the first export of amphetamines was seized in Nigeria. So we have become a producing nation for synthetic drugs. So the problem is increasing. And the West African hub generally is becoming very prominent in trafficking. So, but we lack data. And then what advice do you have for communities or for actions against drugs in the absence of concrete data? Thank you.
Very insightful comment and a concern that we have, and I'm going to let Dr. Hernandez talk to you about that, because your country is not the only country that experiences this problem. It's a very serious problem.
Yeah, and in our work in a variety of countries, we find that either the data sets are missing, there's no household survey, there's no student surveys, or we find that in some countries the last data collection was done 8 years ago, 10 years ago, or there's national data, but there's questions about somebody really going in and doing these kinds of things. What we do is we work with local communities to help them educate themselves on data collection. And there are ways that we help them look at using key informant surveys, mine whatever data may be available, whether it's police, hospital, school, anything that they can find. We also train groups on doing focus groups in the local communities. And we have a strategy which we call knock and talk. We've done it in South America, where actually community residents, coalition members, will go block by block. And they'll do two things. They'll ask people their opinions. In many cases, people will tell us they've never been asked about the drug problem in their communities. Never. This is the first time anybody ever came to talk to them about it. So they'll ask the data, about what their perceptions of availability are, perceptions of use, problems that they're seeing. Some guy will report, well, there's the people next to me, they sell drugs day and night. And we also do that to recruit people. But it's a serious issue. We understand that. It's hard. However, we also understand that people cannot wait until the government gets together and does the national data. It's too difficult in some of the countries. But we ask people to really begin looking at whatever local data sets may be available. Because again, look, if you're in Brazil, it's a large country. Nigeria is a large country. If you're in Sao Paulo, when you're Sao Paulo State, some of the communities I'm working in, yeah, you know, they're not going to go to Rio de Janeiro and help them solve their problems. They're looking at their local environment and how they can impact.
Thank you so much, Geraldine and Fernandez, actually. Dear colleagues, I had an opportunity to, first of all, experience the CADCA activities in the US. First of all, I was initiated to the local groups. The good thing, these people do not go and plant coalitions as branches and organizations, no. It's the people themselves who hear about what coalitions are doing in other states, in other counties, and bring the model at home, and they say we need to start a coalition ourselves within the community. And once they have set themselves up, they ask them for technical assistance. In other words, it's a local initiative which begins within the people. And one thing I noted, because I participated in one of them, SAFE, which is Free Schools, which is in Virginia, Richmond. I participated. These guys collected data and depend on the resources within, because within our communities there are researchers, there are teachers, there are doctors. All these contribute to the information. And what surprised me, much as drug abuse is the real problem and they want to address it, but when they begin to examine what are the causes of drug abuse, many times they find there are other things and they begin to address them. Maybe there's no playground for the young people to play football in the evening when they come back. Maybe there's no library for young people to be busy. Maybe there is no other activities. Actually, they end up doing even community development within, but using the community, the coalition approach. To me, that was very amazing, and I believe for us in Africa, this is one of the things we need to take on, because we don't have enough resources, we don't have money. The grants are no longer coming from the US and Europe. But within ourselves, let's take back the problem to the owners of the problem. Instead of taking program staff to move with the motorbike in the community, educating people, let's empower the people, step aside, and the people themselves begin to address problems. People who are growing marijuana, people who are selling marijuana to the community and to the young people. And this works, and this takes little resources. Let's forget about the money in the US, but I believe this is one of the things we can do. This is very applicable for Asia, very applicable for Africa. I don't know much in Sweden, but I think also in Sweden this can work. And it brings the people together. The people begin supporting each other. People begin enjoying themselves. And even the local leaders begin to be sensitive to the needs of the world. Because the people begin to demand. People begin to demand, we are not doing this, we are not doing this. I saw this happening, and man, I was amazed. And this is one of the ideas we want to promote in our regional conferences, coalition, and even the sub-Saharan Africa. So that government, find a way of giving people money to help them do the problems themselves. And people begin to build schools, begin to build recreation centers. People begin to talk about the problem themselves in their own language, in their own culture, in their own context, in the way they understand it. And once the people are empowered, like they are saying, the drug abuse, substance abuse, and other problems like violence, like beating women. You have many people who are beating women in Africa. Women are like drums. All these things are addressed, and people become empowered and generally reduce problems. So I want to appreciate, and I believe this is what we need to take on. They have given us the literature, and if you need technical support, I know they can always advise. You can even train you on Skype, and then until you move.
Roger, at the end of the session, please come see me, and I'm going to pay you for that commercial. Because he really gets it. And we have these more than 5,000 community groups in the U.S. CADCA doesn't own one of them. They're members of our organization. They're owned by their community. And when the community owns the organization, the community will protect it, will fund it, and will help it grow. But if it was owned by us in Washington, it wouldn't work. We provide the training, as he said, but the community owns it. Another comment? Yes.
CADCA able to give some research information on the cost of damage to the brain to young people over the course of 10 or 15 years, and the deterioration in the community, In other words, prevention, yes, if somebody can grow up healthy and you can get somebody who needs to pay their taxes, you know, and contribute to the community, as opposed to just supporting somebody, whatever they give them, never done whatever it is, but opportunities, diseases, visits to the hospitals, you know, and the deterioration that continues with someone, you know, it starts in the brain with the use of drugs. Is there some kind of study on that, the actual cost, you know, to the community over a long period of time?
Well, what I will say to you is that working with NIDA, we have published publication. We have published a publication like this that talks about the impact of drugs on the brain and on development. So the answer to your question is, we provided our coalitions with science-based information from the National Institute on Drug Abuse that shows them clearly the impact that substance abuse use has on brain development as well as any other development that they're involved in. So to answer your question, we do our very best to inform them so they can inform their communities of the impact these substances has on them. Sue, go ahead.
Yeah, I'm not sure if this works or not, but you know, as you know, there's national data sets to show what the societal costs are of drugs, alcohol, tobacco, and we widely use that and get that out to our people. Whether anybody's done the economic study in a specific community, I'm not sure. But I want to say one other thing to you. Our people don't do treatment, but because they're activists, if one of the gaps that they notice when they're looking at what's happening in their community is that there's not enough treatment, they are the advocates for pushing for more access and availability for treatment in their community, although they are not the treatment providers.
Yes, the comment I was going to mention to you is that we in the U.S. have something called CADCA TV. It's not a national, it's not international, but it's national. And about 6, 8 TV shows per year we put on, and they go out into the cable network to inform the citizens of the U.S. of this problem. And their ratings are unbelievable. So your point is well taken, in that the audience for our U.S.-based CADCA TVs is phenomenal. So would that translate into a national audience for such a program? It could very well. So your point is, I'm sorry? International, I meant international. Your point's well taken, something that we should think about, we should talk about, and I don't know the answer yet. I don't know how you manage it, where the resources would come from, but it has merit and deserves consideration.
As I gave you the idea, I twittered on my Twitter just now,
right,
on a coalition against corruption in India,
right,
and an internet radio. Imagine, it can work wonders. The moment we come on the FM, you will have the whistleblower coming in without the face being seen, but being heard everywhere. So you can have coalitions against corruption, like for instance, we fight corruption in India. We can have coalitions against drug abuse or drug trafficking. I think it can work wonders. Internet radio may prove cost effective.
Something we should talk about.
I think this is the power to give to ourselves now. It's the power of the media through the voice. Because television is expensive. Internet radio may be cost effective. I think we should give it an idea. Let this idea come through this conference and see how do we get sponsorships and put it together. That means anywhere in the world, we could tune into each other.
Sure.
And we could listen to these programs while being still back home.
Yes.
And then add in and then do call-ins. So I think that FM power of the radio, and it crosses barriers. So it's an exciting idea, it just struck me. I immediately tweeted back home, saying, can't we have an internet radio of coalition against corruption? And it started to germinate, it started to develop. So sorry for, I'm just giving you an idea because it just came off the cuff. When you're doing so much, why can't we do more? And do cheaper?
want to thank all of you all. But we have one last question,
Yes.
and then we will bring it to an end so we won't get behind. But thank you all for coming. Yes, your last question.
Yes, it's a comment more than a question. I'm Swedish psychologist and journalist, research journalist. And thank you very much for a wonderful session here. I am very impressed and it gives you all so many ideas. But I have been living 5 years in Denmark, and I have been very now and then in Greenland. And the comment from our friend from Africa was just so important. Danes have tried to, in Greenland they have big drug problems since many, many years. And Danes' traditional way to come closer to this problem haven't been very effective. And they have now started a new strategy through the population themselves and through women also. Women has less drug problems than the men in Greenland. So it's important to stress. Have you been thinking about that also, that women in general have less problem than men in the society?
Well, I would say to you that we keep demographic data on our coalitions and on our conferences, and it's about 7 to 3, meaning that the workforce in our coalitions is about 70% women. 70% women, 30% men. So that tells you that women have a very powerful role to play and are in fact doing just that. So the answer is yes. We understand the power that women bring to this, and they are doing that in the U.S. in a very significant way. So thank you all for your attendance. Make sure you have a booklet. Also go onto our website. You're welcome to go onto our website. Join our coalition online, and you can get a weekly update. All that's free. And we look forward to working with you all and helping as we can back in your communities, wherever you might be in the world. Thank you very much.
Let me conclude this very interesting and informative special session with some few words and remarks. I think, as has been said before, I have had the opportunity to both be in the training course and in your big meeting with 3,000 people. It's very, very impressive. And I think General Dean, Dr. Hernandez, and Mrs. Thau has done an excellent job here today to explain the work done by CADCA and how impressive it is. I think the key for your work is how you are able to mobilize people over sectors in the local community and realize that to be successful there is a need as well for environmental changes. Because the most efficient prevention is good policies. And good policies, it's about very much environmental issues. And I think you have addressed this in a very, very good way. So once again, thank you for coming and thank you for these excellent presentations. Thank you.